extra pleasure to introduce our resource person today, Dr. Dammika Perera. Dr. Dammika Perera has obtained his BSc degree from Faculty of Veterinary Medicine and Animal Science, University of Peradeniya in 2004. Later, he earned his MPhil degree in Advanced Reproduction Biotechnologies from the same university. Further, he is a fellow of Sri Lanka College of Veterinary Surgeons and member of International Embryo Technology Society as well. During his postgraduate studies, Dr. Perera was able to establish the embryo transfer technology, embryo splitting technology, and embryo freezing technology in Sri Lanka. Besides, he is the person who has done the first successful artificial insemination of horse, while being the resource person of the first successful sheep AI project and sex cattle semen AI project in the country. Dr. Perera has published more than 60 research and clinical papers locally and internationally during the last 15 years. Dr. Perera is a large animal clinician and an equine practitioner for more than 15 years. Further, he has been consulting number of equine units which belongs to both government and private sector in the country. Presently, Dr. Perera is a senior clinician of the Farm and Veterinary Teaching Hospital and a senior lecturer of the Faculty of Department of Farm Animal Production and Health, Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. On behalf of Sri Lanka Veterinary Association, I would like to invite Dr. Dammika Perera to continue the webinar. Thank you.
Right. Thank you, Dr. Sugad. I think all of you can see my screen. Is that so?
Yes, we can see it. Yes.
Yes.
Right. Okay. Thank you very much, everybody. And today I'm going to talk about equine colic. Right. Then, what is colic? Colic is simply severe abdominal pain. So, but when we consider that in equine perspective, that's the most dangerous, costly problem in equine practice. In addition to that, it's a multifactorial condition. It is not a simple condition, right? There may have number of causes for the condition. So, when we look at the, as I mentioned earlier, that is severe abdominal pain. So there should have stimulants to stimulate the abdominal pain receptors. As you know, there are receptors in the abdominal cavity. So there should have a mechanism to stimulate those receptors. So when we consider about those aspects, first one is distension of the bowel. As you can see here, sometimes bowel may distended or stomach may distended due to many reasons. In addition to that, stretching of the mesentery, as you can see in the second picture, right? Sometimes mesenteries can stretch, right, more than the usual level. So that is another stimulation for the pain stimulation in equines. So inflammation of the stomach, intestinal wall, or peritoneal cavity is the other reason to stimulate the pain receptors in the abdominal cavity. So not only that, ischemia, then spasms of the intestinal musculature is the other reason, as you can see in the last picture, right? So due to the ischemia or the spasm may stimulate the pain receptors within the abdominal cavity. So those are the primary stimulants for the colic. So when you consider about the predisposing factors, they should have predisposing factors to stimulate those pain receptors. So when you look at that aspect, so we have to first we'll discuss about the anatomical and physiological factors that can stimulate the pain receptors, right? So I think when you talk about that, better to have refresh your memory about the anatomy of the GIT, it means GI tract of the horses, right? When I go through it briefly, you can see the right stomach here, So you may better to notice this pouch-shaped bottom part of the stomach, and pylorus region is at the middle level. It means that feed has to go upright in that point. So then lengthy small intestines are there. Then that we can see blind pouch of cecum here, right? Then cecum may open up into the right ventral colon, but although those structures are wider in size, you can see the attachment of that cecum and the large right ventral colon here, right, in this picture number 9 and number 12, through the narrow opening, right? That point is narrower. So in addition to that, right ventral colon may flex at the sternal area, that is sternal flexure of the colon. Then it may open up into the left ventral colon. That also wider structure. But other thing is, when it comes towards the pelvic area, this is the pelvic flexor, right? Then I think you can see the pelvic flexor here, right? When you look at my cursor, this is the pelvic flexor. It is a narrow position again. Then again, that pelvic flexor, through the pelvic flexor, it may open up to the again wider area, that is left dorsal colon. Left dorsal colon again may flex at the diaphragmatic area, that is diaphragmatic flexure. Again open up into the right wider area, that is right dorsal colon. Then it may open up to the transverse colon. It is a funnel shape one, conical shape one, and it may connect with the narrow small colon, right? So when you consider about the passaging of the ingesta, it may pass through the gut toward against the gravity. It means it passes towards the upright, right? It has to pass along the gut upright direction against the gravity. So those are the other matters. In addition to that, horses cannot vomit. So because of that anatomical arrangement of the stomach, I will discuss those matters in detail later, right? Then as I mentioned earlier, that presence of the unfixed position of the left colon. When you look at this picture, you can see the left view of the stomach. Sorry, left view of the abdominal cavity, right? You can see the left dorsal and ventral colon here, right? It means in this picture, this part, this one, when you look at from the left side, you can see like this. Although that the dorsal and ventral colons have the attachment, ligamental attachment, that entire set has not attached to the body tightly. It is loosely attached. It can move here and there, upright and downward, right? That is the other point. Then, as I mentioned earlier, we can see the lengthy blind cecum, right? Then, yeah, those are the main features that I want to highlight here, right? Then, when you look at the management aspect, so there may have that matters, predisposing factors that can stimulate the pain receptors. That is, those are due to management, right, changes or the failures, right? So first one is irregular exercise and feeding pattern. Sometimes people may use those animals according to their requirement, but when they want, they may put that animal into the stable and will keep there for 1 or 2 days. For an example, during the working days, handlers may use that animal. During the weekends, they want to get a rest, then they may put that animal into the stable, more time, then animal may get irregular exercise. Then feeding pattern, when we consider about the feeding pattern, during the working days, they may give the regular feed supply there, but in the weekends, that handler or the owner wants to get a rest, then they may give a bulky diet for the animal. Then they don't want to come frequently to see the animal, right? They may provide it as a bulk, then animal may have it as a bulky diet. So those are the other things. In addition to that, insufficient water supply. So if that animal is keeping in a stable, right, it is dependent on the management system. Sometimes that people may, or the handler may not provide the sufficient amount of water. If that animal is a free roaming type animal, especially at the drought season, they may not get the sufficient amount of water. So then other one is that sudden dietary changes. Sometimes that especially it may affect with the stall feeding animal mainly. So people or the handler or the owner may change the feed type according to the that may be according to the raw material availability. Sometimes presence of that cheaper material for them, right? Considering the economical aspect, sometimes they may change those things. In free roaming animals, yes, they also can get any type of palatable things available in the pasture that also can cause this kind of problem, sudden changes of the diets. So other one is too much intense exercise. So sometimes people may use that animals for too much of exercise. Right, then usually they may use for that low level of exercises activities. Sometimes they, according to their requirement, they may change or they may use that animal for intense exercises. So that also may affect the stimulation of the pain receptors. Then other one is the low grazing, especially at the drought season. In free grazing animals, free roaming animals, they may get the that kind of problems, because at the drought season they may have that low accessibility to the pasture, right? So then lack of that enough amount of herbs, they may get this kind of problem. Other thing is in management aspect, if they are not providing the enough amount of roughages or herbs, again it would be a matter to digestibility of the ingesta or the grains and other content. So it may affect the microbial flora within the gut, and the mechanical problems may be there. So other thing is use of moldy feed. That is mainly due to storage problems in the storage facilities. When it exposed to the moisture, right, then when they keep those feed bags on the ground, right, without any carpet or anything, sometimes that climatic changes may induce the growth of the fungus mainly. In addition to that, bacterial count also will be increase. The presence of moldy feed, again it can cause GIT problems, enteritis, right? Then access to too much water and food after heavy exercise. Sometimes in the practice, the people may bring those animals to their purposes for the races, safari, whatever. Then at the end of that, they may, after heavy exercise, they may put that animal into because that handler also, may be, tired. They may put that animal into the stable, stall. Then they may provide ad libitum water and excessive amount of grains, especially concentrate diets. Then he may go for to get a rest. So then when we give it just after that, animal also tired, animal may get more water and more concentrate at once. It can cause impaction of the stomach, sometimes over distension of the stomach, and finally it can cause rupture even, right? So in addition to that, too much feed concentrate, minerals, and unsoaked sugar beet pulps, right? In that aspect, especially when handler provide the concentrate diet in high amount, then minerals, unsoaked sugar beet pulp, those can lodge in the stomach. As I mentioned earlier, according to the anatomical arrangement, it is the lower part of the stomach is like a pouch, so it can lodge there. So when we give that excessive amount of it, so that again it can cause stimulation of the pain receptors. So those are the management aspect of factors that can lead to the same problem. In addition to that, when we look at the other factors, So one thing is vices. Vices mean bad habits, simply bad habits of horses. That's a separate topic. So, but I will highlight the related things to this subject. So sometimes horses may have that several bad habits. It means, for an example, they may lick the sand, they may eat sand, they may eat stones, or whatever they can see in the surrounding area. That's they are one of their bad habit. They may try to eat that. So that bad habit may lead to, again, stimulation of the pain receptors. We will discuss those things in detail, right? Then other one is the stress. So they have adapted to response to the sudden environmental changes, right? That's why we have to get the extreme care when we are trying to handle a horse, because when they hear any sound changes in the surrounding area, they may not look at the object. They may kick. After that, they may look at the object. That is their behavior. That is their protective mechanism. So they are a highly excitable type of animals. So especially presence of thundering, lightning, right? Even those changes can cause colic in equines. So in addition to that, when you do that sudden noises around the animal, again it can cause colic. So we have to handle those animals carefully. Then presence of sandy soil at the pasture land. Sometimes owner may have provided enough acres of pasture land for the animal, but that pasture land may be on the sandy soil, right? In that case, while animal is eating, automatically that sands may come to its mouth and animal may eat those things, right? That is the other possibility. Then that those sand may accumulate within the gut. Then previous abdominal surgeries also can lead to colic. So as you can see in these pictures, right, sometimes it can cause adhesions secondary to the previous surgery, right? Then not only that, sometimes it can cause stricture formation of the gut in the along that surgical point. So not only that, sometimes that intestinal materials can leak out to the peritoneal cavity, right, leading to the peritonitis even, right? Those possibilities are there. So we have to consider about those aspects also. Other one is the parasites. So parasitic burden is a big problem in that equine industry, right? If they are, unless they adapted to the proper schedule of parasitic control, parasites may develop within the gut. Then if they are not practicing regular deworming schedule, when they use that deworming after prolonged period, all the that worms may die at once. Then as a clump, they may occlude in the narrow point of the GIT. Those possibilities are there. In addition to that, presence of parasite, they may damage the mucosal layer. When they damage the mucosal layer, it can cause highly irritation to the animal. That irritation may lead to further complication of the gut. Then other one is the foreign bodies. So as I mentioned earlier, when they eat that foreign material, in addition to that, as you know, there may form enteroliths within the gut, right? To formation of the enterolith, that foreign material that they have already ingested may be supportive, right? Then that foreign material may act as nidus of the enterolith. So that possibility also there. Then other one is the tumor conditions. That tumor conditions also may lead to the different complications within the abdominal cavity. As you can see in this picture, when you look at my cursor, right, that tumor may be external to the intestines, but it may compress the intestines externally. Then that it may affect with the peristaltic movement and the passage of the ingesta through that area. Then it may lead to occlusion of the gut. So then other one is the previous medicines already that they have used. For an example, when you use oxytetracycline, OTC for horses, when you inject it, they may get colitis, so leading to colic. So we can't use that OTC for those animals. Then in addition to that, when you use For an example, anti-inflammatory drugs, NSAIDs, for prolonged period, it may cause ulcerations of the, especially at the stomach and the gut, so leading to the colic situation. So those are the basic predisposing factors that can lead to colic in equines. So let's see the signs of colic, because although we have discussed about these predisposing factors, when you get a case that handler or the owner may complain about the signs, right? Then what are the signs you can see at the colic? Presence of mild to moderate colic condition, you may see this kind of signs: loss of appetite. So that your first complaint may be like that. Then when you ask about several things, then you can realize that when you examine the animal, when you look at the animal, you may be able to understand the pawing of the ground like this. Animal may try to paw the ground frequently. Then looking around, looking at the belly frequently, animal may look at its belly, right, abdominal area. Then we may see restlessness of the animal and stomping of the hind feet. It means that hitting using the hind leg, animal may hit on the ground forcefully. So then next you may see the sweating of the animal. Then animal may lie down frequently, and animal may try to be stay in that lie down way and looking at the belly or the abdomen, right? Then depression is the other one. So with the aggravation, you may see the depression. So you may see the lowering of the head, then drowsy eyes, then without animal may reluctant to move like that. So those are the basic signs of mild to moderate pain condition. Then when you look at the more severe cases, in more severe cases, we may see that paw the ground violently. Animal may paw the ground violently. Then animal may appear tired. Then you may see the distended abdomen also there, right? Distension of the abdomen, like here you can see the distension. Then sometimes you may see muscle tremors, right? Then straining, right? You may see muscle tremors, especially at the right shoulder area. In this area, we can see the muscle tremors. In male horses, they may stretch the body and relax their penis without urination. They may not urinate, but they may relax the body and the penis. So then sometimes you may see that kicking the animal violently without having, although any object is not there, animal may kick violently. Then with the aggravation, you will see profuse sweating. Then animal may lie down and get up frequently, right? Not only that, you may see that rolling of the animal on the ground, and the animal may stay on its back like this. Then other thing is sometimes animal may sit on its haunches like a dog. In the second picture, you can see it. This is not a normal position of a horse, right? When they have that kind of pain, they may sit like this. Then when you check the rectal temperature may be high in cases like that severe inflammatory conditions, but it may be lower at the shock conditions. Then you may notice that tachypnea, tachycardia, then lowering or absence of the gut sound. When you auscultate the animal, you may not able to hear the peristaltic movement, boborhythmic sound, but except in spasmodic colic, presence of spasmodic colic, boborhythmic sound rate will be increased. So those possibilities are there. In other cases, you may get the lowering of the gut sound. So when we look at the type of colic, there are different types of colic depending on its primary causes. When you look at the major type of colic, that first one is impaction colic. when you go through the literature, sometimes you may see those things as a obstructive colic or the impaction colic, right? It's a fairly common type of colic in equines. So intestines become blocked by the firm mass of food or foreign material. So that is the primary reason for that. Then in addition to that, is commonly occur in large intestine, especially at the flexors. Already I have mentioned about the related 3 flexors here, right? One is, as you can see here, pelvic flexor. Other one is the sternal flexor here. Other one is the diaphragmatic flexor. Most of the time, those materials may occlude at those flexure level, right? For an example, sand. When they eat more sand, sometimes that may be accidentally, sometimes that may be as a bad habit. So it can lodge, especially at the right ventral colon here, in this area, right? So with the time, it will accumulate there. Then finally, it can occlude like this. It can block the gut like this. You can see in this picture, right? In addition to that, again, parasites, right? When we are at the heavy burden, or when you give the antiparasitic drug, I mean deworming drugs after a prolonged period, then higher amount of worms may occlude or block the gut as a clump. So not only that, presence of low water supply or secondary to any other disease, animal may not get the enough amount of water. Then again, usual ingesta may impacted there. So again, it can obstruct the gut. Then other one is the enterolith. You can see here, enterolith that we have removed at the teaching hospital. So that is secondary to their vices, or when they eat that foreign material, those foreign parts, most of the time, those foreign parts may have higher weight, higher gravity. So when it comes to the wider part of the intestines, it means especially at the colon, right, and cecal level, it can lodge here. With the peristaltic movements, that foreign material may rotate here and there. Then it will get the proper shape. Then with the time, there will accumulate minerals that is available in the feed, will accumulate around the foreign material. Then there will develop a enterolith. So with the time, it will increase gradually. Then when it increase, it may push towards the narrow part of the posterior side of the gut. So then when it comes to the narrow part, it may block in that level. So that is the other possibility. So these are few types of enteroliths that we have removed. So here you can see in first picture, you can see the initial stage of an enterolith, right? Here you can see, when you see it very clearly, you can see the nylon bands, right? It's a clump of nylon. Now it is organizing as a as an enterolith here, right? Then in the second picture, you can see the another enterolith. It is more organized than the first one. When you see it very closely, you can see the cloth here, right? It's a clump of cloths. Here you can see it nicely. Now it is organizing, right, with the deposition of the minerals here. Then finally it will develop into the pictures like this, right? This is a well organized enterolith. So for your reference, a few days ago, I have cut it, right? Then in the next picture, you can see the cross section of it, cross section of the third enterolith, this one. So here we could see the polythene mass, polythene. So, but as I mentioned earlier, they should have higher gravity to accumulate it within the gut. So to remain it there within the gut. But here, polythenes also, most of the time we can see the polythene. The reason is that those animals, those are common among animals who are wandering here and there. Then those animals may eat whatever, right, they can see as a bad habit. Then polythene may not be along with that. So polythene may be contaminated with soil, sand, or stones, maybe sometimes with some feed materials also. Right, that sand, soil, or stones may provide the weight to that polythene. Because of that, polythene may remain within the gut. So in this cross section, you can see. So I have pointed out at the center, you can see one end of a big stone. Right, considerably bigger stone is there at the center. That surrounding part is the polythene, and it has contaminated with sand also here. Right, so then that part may act as a nidus, that center part. Then minerals may organize around the that nidus. So then they will form with the peristaltic movement. It will get the proper shape. Then right, it will develop little by little. Right. So these are several types of enterolith that we have removed from horses. So this is the biggest one that we have removed right at our veterinary teaching hospital. So it is around it is around 8 inches in diameter. So in the second picture, you can see different irregular shape of enterolith. That is totally depending on the nidus within that. So according to the shape of the nidus, it may develop like this. Sometimes, as you can see in the third picture, sometimes you can see this same nidus may lead to multiple enteroliths. That nylon part is the right cause for that. So one clump is here, other clump is here, another small one is developing here. That kind of possibilities also there. When you look at this picture, you can see the different colors, different patterns, different appearance of enteroliths. We can see it is depending on the material, right, and the minerals available to that animal, right? Then when you come to the right picture, right lower picture, you can see a special shape of enterolith. Here you can see the flat surface here, again another flat surface here, right? If you can see that opposite side, again we can see another flat surface even at the bottom. So instead of that oval or the round shape, we may see enterolith with flat surfaces. When you see in your while you are doing a surgery, when you see this kind of enterolith, what are the clues that we can get from that enterolith? So that may be the reason. So definitely when you found this kind of enterolith, definitely we have to check for another set of enterolith within the gut. That flatness is due to friction of each other, right? There should have at least another enterolith there. So those are the possibilities. Here you can see a set of enterolith that we have removed there, right? Due to the friction of enterolith each other, those may get this flat, smooth surfaces. But at the real surgery, sometimes at the time of surgery, we may able to find only one such a enterolith, right, at the site. But if it is having that kind of appearance, definitely we have to check for several other enterolith along the gut. We have to palpate the gut and we have to find for another hard masses there. So then we have to push it towards the site and we have to remove those things also, right? Those possibilities are there. So these are the set of enterolith that we have removed in our veterinary teaching hospital. Right, those are about the impaction colic. So this is that second type is gas colic. So that is fairly common among equines. Then due to gas buildup in the intestines, then it is a usual process. Sometimes gas production rate will be increased. Sometimes they may have transient partial blocks in the guts, slow passage rate. So those can lead to accumulation of gas within the intestines. So that may be the reason or the reason for the this kind of gas accumulations, right? So in ultrasound scanning, we can see that fully distended intestines there, as you can see here, right? Number of cross sections filled with gas and echoic areas, right? Then that is fairly responsive for the treatments, right? Prognosis is good in that case. So other possibility is spasmodic colic. As I mentioned earlier, when the horses are highly excitable animals, so when they get sudden excitement, frightened, nervousness, they may get this kind of condition. In addition to that, when horse drinks cold water after heavy workload, then again may get that stress may initiate the spasmodic colic. So again, it is usually responsive for the treatments. So prognosis would be good. So when we look at the fourth type of colic, it would be volvulus or the torsion. It means simply twisted gut. As you can see in the right top corner, typically we can see like this. So twisting of the gut, that this part, that hanging part may totally occluded there, obstructed there. Then blood supply may arrest. So that lower part may have the ischemia, then initial degeneration, then the necrosis. So without doing the going for the surgery, we can't resolve the problem. So immediately we have to go for the surgery in that case. So here in this pictures, you can see that this is the right dorsal colon, right ventral colon, right? Then sometimes, as I mentioned earlier, this free part of the left dorsal and ventral colon, as it has freely moving there, it can twisted while animal is jumping, moving, it can twisted, but that twisted point may come to the right dorsal and ventral colon. That initially that left side may twisted due to the right free movability, but that twisted point may sometimes may locate at the right side, right dorsal and ventral colon. Again, similarly, it may occlude the blood supply. Then hanging part may undergo the ischemia and necrosis. That those possibilities are there. So that is due to volvulus. Then other possibility is displacement of the intestines. That is the other possible method that can lead to colic. A portion of the intestines may move, right? May displace its original position. Again, when you look at this, that basic picture, this free part of the freely attached left dorsal and ventral colon can move upright and downward, right? Again, here and there due to its freely attachment while the animal is struggling, moving, jumping. So because of the narrow nature of the pelvic flexor here, right, there's a high tendency to have low passage rate in that area, or there's a high tendency to accumulate material there. Then that part may have the higher gravity with the movement of the animal. That as you can see in this this picture, this freely movable part of the intestines may twisted, right? It can sometimes it can, as you can see in the third picture, it can wrap around the cecum and the right dorsal and ventral colon like this. It can wrap around like this, so obstructing the right blood supply and the GIT. So option is we have to go for the immediate surgery. So not only that, another displacement possibility is there. Again, it is with the left dorsal and ventral colon. Right, as you can see here, sorry, this is the left dorsal and ventral colon. Pelvic flexor is there. It can move upright, upward and downward while animal is moving. So unfortunately, there's a supportive anatomical arrangement there. That here you can see the spleen. Spleen has attached with the stomach. Gastrosplenic ligament is there. In between spleen and the stomach, there's a groove, right, depressed area. So while moving that part upright and downward, sometimes it can trap into that groove, right? Then it may cause obstruction of the gut. So in my case, I have seen another complicated situation with that condition in the right lateral side. You can see that picture. In addition to the trapping of that intestine, it was twisted in that case. Twisted and trapping, both conditions were there. Here you can see the twisted point, ischemic appearance is there. So again, that can lead to same problem. So then this is the other possible causes, intersusceptions. So simply it is known as telescoping of the bowel. Commonly it occurs in the ileocecal region. So if you, as you can remember the first picture, at this ileocecal region, it can happen, especially in the small intestines, right? Then it may happen especially with the severe irritation of the GIT. Irritation may be due to severe worm infestation. They may damage the mucosal layer, leading to different ulcerations. So sometimes irritation may be secondary to viral or bacterial disease conditions there, right? Then because of severe irritation, there may that peristaltic movement may be vary. Then animal may have excessive straining, right? Then excitement, especially in foals, that can lead to telescoping of the or the intersusception of the small intestine, especially, right? That can lead to the colic. Again, surgery is the option we have for that. Then seventh one is enteritis, colitis, or diplocolitis. So enteritis, as you know, enteritis mean that the infection in the inflammation of the small intestines. Then colitis mean inflammation of the colons. Then diplocolitis mean inflammation of the colon plus colon and the cecum, right? Simultaneously, those can happen there. That is the that primary causes may be due to bacterial, viral, or fungal type of infections, right? That may be secondary to rotten, when they use rotten feed for the animals, right? When the animal eat whatever rotten things in the available in the pasture lands or the environment. So that can cause multiplication of pathogens there. So sometimes, most of the time, we have seen in several cases that because of their failures to maintain the proper storage conditions, that can lead to fungal multiplication on the concentrate diet. When you look at the concentrate, we can see darkening of those pellets. So when you smell it, you can feel the rancidity there. Then when you check the sample, we can find high aflatoxin count level. So that can again lead to severe inflammatory condition. Then sudden dietary changes. Sudden dietary changes may cause pH changes within the gut. So acidity will be vary. That sudden pH changes may act against the supportive common cells. Then those levels may be lower. Then opportunistic pathogens may multiply rapidly there, and they may replace the area with that. Then they may lead to enteritis. So animal may express the signs of colic again. The eighth type of colic is gastric distension. So gastric, when you look at the gastric distension, primarily that is due to engorgement of the stomach, mainly with that concentrate diet, right? So when we give that bulky diet as a wrong management practice, it can lodge, it can accumulate within the stomach. So when we when those people give the concentrate diet without giving water, without giving herbs at first, that concentrate diet always tend to accumulate there, right? That anatomical arrangement also in the stomach is supportive to have that. In addition to that, unfortunately, they have those horses having another weak point, as I mentioned earlier, in their esophagus. When it opened into the stomach through the cardiac region, cardiac sphincter is a muscular, right, thicker sphincter. It's a thicker sphincter. It is working only one way. It may open up into the stomach, but never open up in towards the esophagus. So once they eat something, it may remain within the stomach. It has to pass through the gut to expel out it, right? That is their natural arrangement. So although it is engorged with the concentrate diet, then they will produce more gas. Then they will tend to inflation of the stomach. Ultimately, it may rupture, but that sphincter may not relax, right? So that possibility is there. That is the other type of gastric distension colic. Next one is the thromboembolic colic. That also possible in equines. So that may be due to primary, that basic common cause is due to larval migration of the bloodworms along the especially at the mesenteric artery. Cranial mesenteric artery is the most vulnerable area. So once they pass through the mesenteric artery, those larvae may mechanically damage the mucosal layer of it. Then there will arise blood clots. With the blood flow, those clots can separate from the attach point, and it can obstruct at the capillary level, then leading to ischemia, and then necrosis and rupturing of the affected intestinal part, leading to peritonitis and death of the animal. The thing is, the matter is, those animals may not express the acute signs most of the time. It would be a gradual process. Then we may delay to understand it. That is the other possibility, because they may express the mild to moderate signs throughout the period until the last moment. Then Strongylosis vulgaris is the main parasite that can lead to this matter, right? Then in addition to that, we have seen several other cases. Blood clots can arise within the blood vessels, even in other animals, even in humans, right? Then with the normal mechanism, it will dissolve there. But when we use those animals for heavy exercise, heavy work, when that clot obstruct in that kind of places while animal is in heavy exercise, it means while animal is having high blood flow, high blood pressure, sometimes it can cause rupturing of the blood vessels, especially at the same mesenteric arteries, right? Then prognosis is poor, especially in this thromboembolic conditions, right? In this picture, right lower picture, you can see this is from a real case. We have done this post-mortem yesterday, right? So that kind of possibilities are there. So in addition to that, there are several other causes, and there are unidentified causes still there, right? So that area is open to do the research and identifications. Sometimes animal may express continuous colic signs. So although we have done all the tests, and those may be negative, but animal may express the signs. Those possibilities are there, but in most of the cases we can diagnose. Most of the cases belongs to those previous 9 categories, right? The other important thing is diagnosis, right? For diagnosis, we have to use these clues. We have to get the history, signalments, clinical observations, signs of pain, clinical examination, laboratory examination, then radiography, ultrasonography, then ancillary diagnostic aids, right? We have to use these techniques for that. So using the techniques, we can try to diagnose the condition. So we'll go through those things in detail, right? When you look at the history, that is very important to rule out this different conditions and to diagnose the particular condition. We have to ask many questions from the handler or the owner. about the medical history of the animal, whether it is a recurrent condition, right? Then whether they have done it has gone through the abdominal surgery previously, right? So then they are that feeding pattern, whether they are under stall feeding or free grazing, right? Then about the possibility of ingestion of sand, foreign bodies, then accessibility for sand and foreign bodies. So we have to ask about those things to rule out possibilities one by one. Then the changes and storage of feed. So we have to ask about their storage condition, right? Then recent sudden changes of the feed. So then consumption of water availability, then recent consumption level of the water, then changes in exercise level, whether they have used that animal for a heavy exercise during the last few days, like that. So then changes of the stable. Sometimes when they change the stable according to the management requirement, because that animal may be right in one place, then that particular person, sometimes a person may hand over that animal to the somebody to look after that. Then they may bring that animal to a totally different climatic zone. Then those changes may lead to excitement of the animal, right? Then frightening of the animals. So then we have to ask about the recent dentistry. So if it has gone through the recent dentistry, sometimes it may end up with gingivitis. So gingivitis, because of that pain, animal may have low appetite. Low appetite when it lasts for a few days, animal may have low content within the stomach, but there may accumulate HCl acid. Due to accumulation of the acid, it can lead to ulcerations of the stomach. So as you know, that lower part of the stomach is having glandular part, then our top part is non-glandular part of the stomach. Then in between that, we can see the margo obliquatus band. So most of the time we may see the ulceration just above the margo obliquatus. That is due to that is within the non-glandular area. So with the accumulation of the acids, while animal is moving, it can flash. So when once it contact frequently with the non-glandular part, it is sensitive for that. Animal may get the ulceration. So those possibilities we have to rule out. Then deworming history. So as I have mentioned earlier, it can lead to the same problem. So we have to ask about the deworming history. Then other treatment or the medications, during the last few days, though, because we have to ask those things carefully. As we know, sometimes those handlers, owners may have given certain injections to those animals, right? So we have to ask about the giving of OTC, giving frequent injections of NSAIDs. So we have to get those informations carefully. Then when you look at the signalments of the animal, in between 2 to 10 years period is the highly vulnerable period for colic, because during that period they are highly susceptible, for different. At the younger stage they may get colic due to number of excitement. With the age, there's a high tendency to have that obstructive mass such as enterolith. Right. So then when you look at the highly vulnerable breed, Arabian horses are the highly vulnerable breed for this colic condition. So when you look at the clinical observation, so when you go there, we have to observe the animal, behavior of the horse within the premises. So we have to observe it. Then we have to look at the appearance, expressions of the animal. It would be supportive to understand the severity of the condition. Then abdominal distension. We have to look at the abdominal area, especially right ventrolateral area. So where the intestines are located. So especially presence of gas colic, you can see the distended abdominal area in that particular region. So then sweating, muscle fasciculation or the muscle tremor, area of the self-inflicted trauma. Animal may get the self-damage, with the that excitement like that. facial expressions, right? It will be supportive to understand the condition like that. So different conditions are there. In addition to that, we can observe the defecation. So sometimes we may notice absence of the loss of the feces there. Sometimes we may notice that scanty feces. Sometimes we may notice that loose feces without foam nature, like watery semi-solid feces. So those would be very much supportive to understand the severity of or the changes of the GIT that can lead to colic condition. So other one is signs of pain. Already I have discussed those parts. So you know that lying down frequency, then that stomping, right? Then that sweating, bowing on the ground, kicking of the abdomen, right? Then rolling, right? Many signs are there. We have to observe those things. Then when you look at the clinical examination part, when you start your clinical examination, you may see the increased respiratory rate, right? In most of the cases, but not in almost all the cases. Sometimes at the mild stages, you may not notice that. Then high temperature. Sometimes slightly elevated temperature may be there, but in conditions such as enteritis, we may notice the elevated temperature, highly elevated temperature, presence of the inflammation at the gut. That also possible, but at the latter part, temperature may be lower. So at the final stage of the animal, that those possibilities are there. Then when you check the oral mucous membranes, color would be pink in normal animals, as you can see in the first picture here, right? That would be the expected salmon pink color. Then sometimes it would be cyanose, that presence of hypoxic condition or the toxic conditions. So sometimes it would be muddy or the pinkish color, that you can see that appear hyperemic appearance with the infectious situations, right? When you check the moisture of the moistness of the again gum, it would be dry. Then when you check the CRT, it would be higher than 2 seconds. Those are the possibilities. In addition to that, when you check the heart rate, it would be increased in most of the cases, but at the mild cases, sometimes you may not notice that. With the aggravation of the conditions, that pain may stimulate the respiration and the heart rate. So in advanced cases, definitely we will able to observe it, right? When you auscultate the auscultation or percussion in the abdominal area, especially at the right ventrolateral area, right, where the intestines are located. In most of the cases, we may notice the lowering or absence of the peristaltic movements there, right? And so that may be due to obstructions there that except in spasmodic colic. In spasmodic colic, it would be higher in that level. So those are the other possibilities, right? Then when you examine the when you do the rectal examination, we may see the distended or edematous small or the large intestine. Sometimes we may able to feel it in your rectal examination. Large intestines or the small intestines, for an example, presence of volvulus condition. It may occlude there, then that obstructed part having ingesta, that pathogens are there, they may produce more gas. Then it will distend, then due to accumulation of the gas, that bowel loops may distend. Then it may float within the abdominal cavity. In the rectal examination, you may able to feel that distended intestines there. Same way that presence of displacement of the especially large colon, again, it may obstruct, then that accumulate, there may high tendency to accumulate the gas. Then again, we may able to feel it rectally, right? Then other thing is in your rectal examination, we may able to feel the infection of small, large intestines, especially when it closer to the rectal area, right? Not always. So in other thing is we can, as mentioned earlier, displacement of the large colon when it trapped in between spleen and the stomach. So we can feel the end part with the distended manner, right? Even in your rectal examination, that possibility is there. So then not only at the right observation, inserting our hand, we can examine the loss of or scanty or so that semi-solid feces there. When you insert your hand, you can realize that loss of absence of feces within the rectum. Sometimes scanty feces there, that small amount of formed feces, as you can see in this picture. Sometimes that semi-solid unformed feces may be there, right? So in your clinical examination, you can identify it. Sometimes you may see that you may able to find hematochezia also there, right? Then feces, unformed feces with the blood, so that also possible. So the meaning is loss of appetite, loss of feces mean that is due to complete obstruction of the gut. So scanty feces mean that partial obstruction of the gut. So then semi-solid feces mean that is mainly due to enteritis condition, or the colitis or the enteritis or the triplocolitis condition, right? Then that pellets formation not be there. So with the aggravation of it, you may see the bloody feces in the enteritis condition. So other possible examination is when you have doubt about the distended stomach, we can insert a nasogastric tube, right? We can insert nasogastric tube through the nostrils. Then when it reach to the right through the sphincter, we can pass it. When it reach to the right stomach, if it is fully engorged, fully distended, gas accumulated, that gas, fluid, and diluted that ingesta may come through the nasogastric tube as a nasogastric reflux. So that way we can confirm that also. Right, then laboratory examination. When you look at the laboratory examination to diagnose the condition, we can get a blood sample and we can check it under laboratory condition. Then sometimes it would be supportive to diagnose the presence of lower total protein level, right? Sometimes that may be you may able to find the high PCV level, right? High PCV level may be due to dehydration. That low protein level may be due to rupturing of the intestines within the abdomen, right, due to loss of the protein there. Then when you check the WBC count may be lower with the rupture of the intestines. So sometimes we can get that clues to identify the possible reasons there, possible possibilities there. Then we can analyze the peritoneal fluid. We can collect it from the most dependent part of the abdominal area, just right side to the median plane. We can collect it. Then normal, as you can see in this picture A, this is the normal color of the peritoneal fluid. Color would be clear straw, right? Appearance. Then cell count, when you check the WBC count of the peritoneal fluid, it would be less than 5,000 per microliter. But when it affected, right, if it is having right peritonitis conditions, right, when it affected, they may have higher than 5,000 WBC per microliter. Then the color may change straw color to more reddish color in appearance. When you check the even other cell types, WBC count, erythrocytes, so red blood cells, that would be higher in count. That possibilities are there. So other clues can get through the radiography, right? That is really valuable to understand the right enterolith conditions, presence of impaction. Right here in these two pictures, you can see the accumulation of sand within the right ventral colon. Right, then here you can see the formed enterolith within the gut, so that way we can understand it. So then ultrasonography is the other supportive method to diagnose the condition. Then we can sometimes we can see the obstructive mass via the ultrasound scanning. Then we can observe the consistency of the ingesta, whether it is impacted, whether it is moving there, right, whether it is having more gas, right. We can observe those things. Then we can observe the intestinal movement, whether that rate of the peristaltic movement, right, thickening of the wall, right. Then likewise strangulation, interceptions, we can observe those things via the ultrasound scanning even. So when you look at the ancillary diagnostic aids, we can use endoscopy, right, especially when you suspect gastric ulcerations, then gastric impaction. Other than that, some very rarely they may have that carcinoma types, tumor types, squamous cell carcinoma. So through the endoscopy, we can see those things. If you want, you can get a biopsy sample for the further investigations. So in this picture, you can see the ulcerations at the non-glandular area. So this is the glandular area, right? Likewise, we can see that. So other than that, we can go for the laparoscopy. Right, when you go to the laparoscopy, again we can see the trauma within the internal organs, then colonic displacements, strangulations, adhesions of the intestines. We can see those things through the laparoscopy. That would be very much supportive. So while animal is in a standing position under the sedation and local anesthesia, we can do that. We can see the changes within the abdominal cavity. That also very much support you to understand the situation within the abdominal area. So when you look at the treatments, mainly presence of that our client or the owner or the handler may notice that primarily. Then they may call you. Sometimes when they call you may be far away, right, from the particular place. Then, but over the phone, they may ask about the first aids, the things that we should do initially, right? Then for most of the cases, right, if we advise them to do the hot fomentation of the right ventrolateral abdominal area would be very much effective, right? We can ask them to put that warm water into a bottle and do the hot fomentation, or using the IR lamp if it is available, or using at least using hair dryer, right? They can do the hot fomentation of the right ventrolateral abdominal area, right, until you reach there for the further investigation. For most of the, because gas colic and those are highly in most of the cases we can see gas colics, right, and it is very much effective for those conditions. Even for other conditions, to give a relief to the animal, we can use that hot fomentation until you reach and do the further examination. So not only that, we can ask them to do the walking exercise. That's another relief to the pain, and we can change the mindset of the animal to give a psychological relief. So we can ask them to do the walking exercise. And meantime, we should ask them to stop the concentrate diet if they are giving it, and if animal is having that appetite, animal may tend to eat that, but we should ask them to stop that concentrate feed. So and to maintain it under herbs, right? Those are the first aids that we can inform them. Then other thing is, after going there, if it is a main thing is we have to control the pain of those animals. If it is a mild condition, we can go for the flunixin meglumine. I have given all the dose rates and routes, right? Or ketoprofen. We can use one of that. right? Then or we can use Buscopan compositum as a anti-inflammatory and spasmodic action also there. So then we can use one of that for mild colic to give a relief to the pain. So presence of moderate level colic, then again we can go for the flunixine, meglumine or ketoprofen, one of that. With that we can use Buscopan compositum, right? And again, if it is developing towards the severe side, then we can use xylazine or detomidine. It means one of that. So in moderate level, we can use flunixine or the ketoprofen plus Buscopan, right? When it is developing towards the more severe, then we can go for the mild level of xylazine or the detomidine. So those are all are in IV route, right? So if the condition is severe, right? If you can see the severe signs, then definitely we have to go for better to go for the xylazine or detomidine, right? Then to have more potentiate action, we can couple xylazine with several other drugs, as you can see here, right? Butanol, right? If it is available, we can use that like that. So we can use those things for to more potentiate the action, right? That way, those are sedative drugs, and at the same time, then analgesic action also there. So we can use those drugs to give a relief from the pain, right? But specific that primary cause would be there. So we have to have that treatment for even primary causes. So if you suspect gas colic, it means when you are in your examination, right? When you auscultate the abdominal area, you may able to hear the absence of low boborygmic sound, or in your examination, you may able to see the distended intestines there. Then externally, you may notice the distended abdominal area at the right ventrolateral side. So then in addition to that, sometimes you may notice farting of the animal, right? Then you can use the hot fermentation. You can ask them to do the hot fermentation and walking exercise, right? Further, in addition to that, we can give that garlic and the ginger to those animals. We have to crush those things together, and we can give it to eat, or we can use the juice of it and we can drench it, right? It would be very much support you to have the relief from that colic. Then not only that, we can do the lukewarm water enema even, right? Using 1 to 2 buckets of lukewarm water using the enema pump, we can do the enema, right? When you do the enema, we have to cover the gastric tube. We have to cover the tube, enema tube, using your hand. It means the end of the enema tube, right? If you can see this finger, you imagine this is the tip of the enema tube. We have to cover it using the other hand, not the block. You have to just cover it. Then you have to insert it to the rectum. So we should never pass the enema tube along through the rectum. It may perforate or it may damage the rectal area, right? Then we should ask somebody to pump the fluid. It may go more anteriorly, right? Then it may be support you to stimulate the myenteric and Auerbach flexors to support the peristaltic movement there, right? When you suspect spasmodic colic, it means after lightning, thundering, right? Then when you auscultate, you may able to hear the higher boborygmic rate, right? Likewise, when you suspect it, then we have to go for the Buscopan compositum, because it is having that analgesic action plus spasmodic and spasmolytic action is there. So after that, we have to provide the calm environment to the animal to settle it, right? So those are the specific things that we have to do for the spasmodic colic, and it is very responsive, fairly responsive. Then when you suspect about the enteritis, colitis, or triplocolitis, definitely we have to go for the antibiotics, right? Most probably IV antibiotics, right? It means in your examination, right? Per rectal examination, if you can see the semi-solid feed material. So if you can see externally semi-solid feed material, then when you do the ultrasound scanning, sometimes you may see the feces through the gut, ingesta through the gut. So in that case, you have to suspect about the enteritis condition. Then you have to check the feed storage, right? If it is having moldy feed, then we can have to check for the rancidity. Then we have to send a sample to analyze the toxic levels. So after toxic level, during that period, we have to start the antibiotic. Better to go for the IV antibiotic for the betterment of the animal. For an example, we can go for the cefuroxime in IV route. Right, then sometimes endotoxemic to give a relief from the endotoxemic condition. If we have facilities to identify the possible toxin, then we can go for the possible that antiserum. Then or else, considering that, we can give flunixin also. It is very much useful to control the endotoxic conditions. Right. In addition to that, presence of gastric distension. Again, we have to, as I mentioned earlier, we have to insert the nasogastric tube. When you insert the nasogastric tube, again, we have to lubricate it. Then carefully we have to insert it. While you are inserting the nasogastric tube, using the other end of the tube, we have to better to blow through the nasogastric tube. While blowing through the nasogastric tube, you have to pass it, because that esophagus is that soft part of the tissue, and although it is tube-like structure, it is not it is not having a cylindrical cross section. It's a flat structure. When you try to pass that tube, it may damage the mucous layer of the esophagus. So once you blow it through the nasogastric tube, while you are blowing, when you try to pass the nasogastric tube, front part of the esophagus, front to the right tip of the nasogastric tube may inflate with your blowing. Then without any friction, that tube may go to the stomach. So that way we can remove the nasogastric reflux, giving relief to the animal, right? When you suspect that matter. Then presence of volvulus torsion, displacement, intersusceptions, definitely we have to go for the laparotomy surgery under general anesthesia. So if you see the thromboembolic condition, again we have to go for the surgery, right? Although you have to go for the surgery, when you go through the literature, you may see that prognosis is poor, right? Then other one is impaction. When you notice that impaction, last option is the laparotomy and do the correction of it. But before go for that, there are several other chances, other opportunities for that. We can do the intestinal, we can introduce intestinal lubricants. For an example, mineral oil, liquid paraffin, 2 to 4 liters per head. Per head mean 500 kg animal, adult animal. Then in addition to that, we can use diethyl sodium sulfosuccinate. So, 20 milligram per kg in 4 liters of water. We can either drench or we can use it to do the enema. So it will be very much supportive when you suspect that impaction due to fecal matter or meconium in folds. If you are using for folds, we have better to go for 1 liter of it maximally, right? For adults, we can go for the 4 liters of it, right? Then it would be supportive to softening of it. Then we can use magnesium sulfate, right? Dissolved in warm water, and we can give it in oral route. Presence of impacted mass of feed, right? It would be very much supportive to loosening of that. Then psyllium methyl cellulose fiber, right? We can use presence of when you suspect sand accumulation within the gut, right? We can give it 1 or 3 times daily. Then it would be supportive to evacuate the accumulated sand. So in addition to that, in addition to the introducing of lubricants, we can do many things. We can use lukewarm soap water enema, right? So then after introducing that intestinal lubricants, then we can do the lukewarm soap water enema, right? We have to dissolve soap in warm water. Then using the enema pump, we have to pump it. That lukewarm water support you to stimulate the peristaltic movement of the gut, stimulating the myenteric and bulbar flexors. Then warm water may, that soap may support you to lubricate the gut. So in addition to that, then as a next step, after the enema, then we can ask them to give the walking exercise to the animal. Again, it would be support you to stimulate the gut peristaltic movements, right? Support the passaging of the right ingesta through the gut. We can try that way initially. Then if it is not responsive, then we have to go for the surgery. Then after that, we can have to consider about the supportive or the prophylactic treatments. So then fluid is the essential part there. So we can use IV fluid. So sometimes we may have to use a stomach tube to or manually we can drench it. But when you suspect nasogastric reflux, that means distension of the stomach, we should not go for the oral route, right? Bulky fluid, right? So the other one is the other possibility is the gastric ulceration. Sometimes due to many reasons, animal may have low appetite, presence of low appetite for several days. Those horses are highly vulnerable for the ulcerations, as I mentioned earlier. So to prevent that, we can use systemic antacids. Cimetidine is one of that. Then we can go for the local antacids, magnesium hydroxide or aluminum hydroxide containing product. Brand names Gelusil, right, Baleseed, many brand names are there. We can use those things to control the possible gastric ulcerations. So prevention is the best one, right? So we have to consider about the prevention. So considering those aspects, even after our treatment, we have to educate our clients to prevent these conditions again and again, or for their other animals, right? Then we should advise them to provide enough physical activities to their horses. In some animals may keep the horses as pets, but when they want, they may use those animals for riding. Even in other period, they may put that animal into the stable and keep there, right? That is not suitable. Although we don't want to use that animal daily, we should advise them to provide the physical activities, or at least walking exercise, right? It means 45 minutes morning, 45 minutes evening, right? We have to provide the walking exercise for that's even stable horses, right? Then maintain the regular feeding schedule without changing the feeding schedule. They have to maintain that feeding schedule regularly, right? Sudden changes may lead to that pH changes of the gut, right? Leading to as I mentioned earlier, multiplication of opportunistic pathogens, right? End up with enteritis. So we should ask them to ensure the constant access to the clean water, right? Absence of clean water or absence of enough amount of water, again, it can cause infection and many complications, as I mentioned earlier. Then we should advise them to provide at least 60% of digestible energy from forage. It means they should have enough amount of herbs in their ration, right? Then it would be, because it contains more fiber. Fiber may support you to passage process of the gut, right, without obstructions. Then do not feed excessive digestible energy that can lead to accumulation of amino acid, leading to ulcerations and further complications. Do not feed moldy hay or grain, although it is cheaper, although it is available. We should prevent accessibility to those moldy hay or grain, right? Then feed hay and water before grain. That is very, very important, right? As a practice, they have to do this. If they are doing that way, right, they can prevent that infections of the infection of the feed material within the stomach, right? So at the beginning, they have to give the herbs. Then when they give herbs, hay, that concentrate feed may drop down onto that hay. Then it will mix with that. Then that fiber content may support you to passage it without any blocking of the stomach. Then when they give water before the grain, then water is there, then grain may drop down onto the water, dissolving it at the water. And again, animal may not have difficulty to pass it through the right gut. So other thing is provide access to the forage throughout the day, right? Not only at the feeding time, they should have throughout the day. That is one of the habit. So after the exercise, when they put that animal into the stable, always we should ask them to provide additional hay. So they can practice like this. They can hang a hay bag within the stable. Then animal may not eat at once through that hay bag. They may prehend little by little, right, throughout the day. It is very much support you to maintain the gut health. They may maintain the enough amount of fiber content throughout the gut. So do not allow to overgraze the pasture land. Sometimes it can happen when we put those animals, a higher number of animals into the limited acres of the pasture land, or at the drought season, right? When we put the animals into the same pasture land frequently, right? It can happen. We should avoid that to prevent the ingestion of the soil, sand, and unwanted material there. Then do not feed water before they cooled out. It means after the heavy exercise, after putting into the stable, they should not provide feed or water at once. We should allow it to cool down there at least for 1 hour. Then animal may start normal feeding. After that, we can provide the recommended level of feed. Then maintain the regular exercise regime. So they have to maintain the regular exercise regime, as I mentioned earlier. Although they are not using for their purpose, they have to provide the regular exercises to the animal. Then other very important thing is they should make all the changes in diet, exercise, and management system gradually. And those horses may not be able to tolerate those sudden changes. For an example, when they want to change the diet A to diet B, first, they have to provide 70% of diet plus 25% of diet as a mixture. Then they have to continue it for several days. After that, they can give 50% of diet A. They can add 50% of diet B. Then they can provide as a mixture for another several days. After that, they can reduce it up to 25% of diet A plus 75% of diet B, as they want to increase the diet B right there. So that is the way they should do it. Then we should ask them to control intestinal parasites. Then we should advise them to check the effectiveness of that antiparasitic drug periodically. It means they should check the dung sample for parasitic eggs. Then next, we have to advise them to not to use the expired antiparasitic drugs. So other one is the lubricants. So when you for the susceptible animals, if those animals are free roaming especially, so we can drench GIT lubricants in 3 to 4 months interval, right? Then for an example, we can drench 2 to 4 liters of liquid paraffin in 3 to 4 months interval for that kind of animals. Then that presence of that early developing enteroliths or the other foreign materials may flush out with that, right, without developing to the right obstructive level, right? Those are the things that I have to highlight here. So according to the time factor, right, I'm going to stop this in this point. Thank you very much for your kind attention.